All right, so HPSO is malpractice liability insurance, and they give out these cases every now and again. Now, the injuries in physical therapy are really unusual, especially in comparison to other fields of medicine, but they can happen. And this was a really interesting case. So I think I have a lot of issues with how they came to the conclusion that the physical therapist and the physical therapist assistant were the problem. But there was one thing that I hope we all pick up on that was the issue. So this place had a PT, business owner, and a PTA that was newly licensed, only been employed for about 3 months. Patient had a 35-year-old male, PT for ongoing low back pain. Initial evaluation diagnosed sciatica, decrease. Oh, sorry, I'll do that. So on 5th day, patient complained of pain during hip flexion using the multi-hip machine. You guys know what that is? Little, it's just a, if you think of the leg extension machine, right? It's just one of those pads that you get to move, and they can do this to it. They can do, it's resisted hip mobility with that. Primary PT instructed the patient to stop using the machine and provided alternative exercise. What do you think about that so far? Yeah, great. But during the deposition, PT testified that his recommendation was documented in a notebook that the physical therapy practice staff used to informally communicate about patients' care. All right, what do you think about that? Not documented in patient's plan of care and health information of record, nor was it verbally communicated to the PTA and the treatment team. Notebook was no longer available at the time of the lawsuit. All right. It's nice when things go missing, right? After missing a few appointments, 2 weeks later, patient returned to PT and reported the PTA unable to attend the previous sessions due to worsening back pain and onset of new hip and leg pain. All right, what do you think about that? What's your next step? Yeah, it's your PT, it's your patient. Yeah. Why? What specifically is it that is concerning? The new pain, the new pain. So the worsening of the back pain, they haven't been there in 2 weeks. Yeah, all right. I can handle that. The new hip and leg pain is the thing we have to worry about. The patient acknowledged complaints but did not consult the primary PT, initiated this session with the multi-hip machine, and increased the weight on the machine. So, all right, but if it wasn't communicated to PTA to not use that hip machine, whose fault is that? I would say it's the PT's fault, right?
But there's
The new pain should have, yes. And the other thing I'm concerned with is, why did you jack up the weight when he was complaining of worsening problems? Like, that to me doesn't make sense either. Within minutes, patient complains severe pain, directed to rest, prepare alternative exercise, although unable to continue to observe limping out of the building. 2 weeks later, patient weight of pain, same PT assessed the patient for muscle energy techniques to relax the muscles and realign the hip. All right. Immediately complained of excruciating pain and severe muscle spasms. Primary PT conducted brief assessment, provide therapeutic ultrasound and soft tissue mobilizations. PT owner also came to perform long axis distraction, mobilize the hip joint. None of the treatments were documented in the health information record. Patient still had problems. The patient subsequently underwent orthopedic evaluation, diagnosed with femoral acetabular impingement and a CAM lesion, and an anterior hip labrum requiring surgical repair. The underlying conditions of this hip impingement and the CAM lesion were discovered and were not known at the time treated. So what those are is those set up the hip labrum tear. The anatomy that person has is unique and it causes labrum tears. But the patient filed the PT and the business and the PTA and won, I think it was, what did it say? Greater than $1 million worth of damages. And that also is to pay legal fees, that's to pay for the surgery, that's to pay for time out of work, and some pain and suffering damages too. Yeah, $1 million isn't going into that person's pocket. It's being spent on a lot of different things, but yeah, we have lawyers. So now I saw this on a Reddit forum, and every single PT said, but it's the anatomy of the patient caused the hip labrum tear. The hip machine itself didn't. The patient's ortho testified and said it was because of that hip machine. I don't think you can say that, especially knowing the patient's abnormal anatomy. But it was discontinued and the PTA did it with more weight later. That's a problem, right? So while we as PTs and PTAs can look at this case and say, it's the patient's anatomy that was the problem. What was the things that we could have solved? The communication and documentation was it that we should have appropriately done. So this, I don't think this is the patient got injured by the hip machine. I think this is a patient got injured because of lack of documentation. That to me is why this person won $1 million. And it's not, if we were to really truly read all of their notes, if they had good notes, and it doesn't seem like they did, because especially it says that all of the treatments they tried weren't documented too. So I don't think their notes were all that great to begin with. But let's just say the first visit, the patient did that multi-hip machine, complained of a lot of pain. We stopped the exercise, and then the patient never did that machine again. Do you think we would have gotten to this point? Probably not. Probably not.
That initial pain, perhaps they would have tried more together.
Yeah. I think this is a poor documentation case, not a selection of exercise problem or the selection of modalities or manual treatments. None of that was the problem. The problem was the lack of documentation and the lack of communication. So I saw that and wanted to alert that to you and know that you guys aren't going to make those mistakes.